Years of conflict and economic collapse have pushed millions of Yemenis to the brink of creating one of the world's worst humanitarian crises. This report has more details.
After 10 years of conflict, Yemen continues to face one of the world's most severe humanitarian crises. Current estimates show that 80% of the population now lives below the poverty line, while more than 19 million people require humanitarian assistance. The ongoing conflict has driven 4.5 million Yemenis from their homes, many forced to flee multiple times as violence persists. Alongside displacement, the country faces widespread food insecurity, malnutrition, water scarcity, and recurring disease outbreaks, all of which are expected to worsen as regional tensions escalate. Families living under these harsh conditions are struggling to meet even the most basic needs. Many parents can no longer afford food, medical care, or schooling for their children. According to recent humanitarian reports, 55% of children under 5 suffer from chronic malnutrition, a shocking figure that continues to rise. Yemen's healthcare system, already weakened by years of conflict and economic collapse, is now operating at half capacity. Recent funding cuts have forced the closure of 2,000 therapeutic feeding programs, leaving thousands of children at heightened risk of malnutrition and preventable deaths. The World Health Organization reports that Yemen recorded the highest global burden of cholera last year. Meanwhile, the UNFPA notes that one woman dies every 2 hours from pregnancy and childbirth-related complications, most of which could be prevented with adequate medical care. Yet despite these overwhelming challenges, Yemeni families continue to demonstrate resilience and determination. Humanitarian organizations such as Concern continue working with thousands of displaced people around the world, emphasizing that behind every figure is an individual with dignity and hope for a better future.